Good morning, everybody. Thank you for logging in and watching. It's the February 10th, 2022, a weekly update for the COVID response team and Health and Human Services. I am Troy, Director, HHS, and we'll be getting started here soon to get the update going. We're just waiting to see if we're going to have any of the other team members join. Raylene's in. Rebecca's in. Thelma's in. Is that better, Raylene? It's upbeat. All right, looks like we have just about everything. What happened to LaDon? She popped out of there.
It said, I don't know, refresh. So I've got to go back in.
Okay, a couple more minutes. We have about 4 folks that are logged in watching right now. I didn't hear you, Raylene. I didn't know what you said. Still can't hear you because I have my headphones on. And there we all are. Good morning, everybody. Like I said earlier, this is our Thursday weekly update for the COVID response team in HHS. Today's date is February 10th, 2022. We're going to give you a quick update on what our current COVID status is in the Pueblo. And then we have a presentation today from Rebecca, our public health nurse, on COVID and its effects on the heart in the interest of Heart Health Month. So I'm going to try to share my screen here. That's not what I want to share. Okay. How's everybody doing today? Thelma, you doing good?
She got that walk in.
Oh yeah, that's right. You had your walk today, Thelma.
Yep.
I walked this morning and then I took a 15-minute walk earlier. So
Nice.
doing good.
That's that activity we're trying to promote, right?
I'm gonna jump on the bandwagon and join you tomorrow.
All right. So I'm sharing my screen. This is a report, COVID report for today, so you guys can kind of take a look at what's going on. Current case count in the Pueblo is still 14. Made a report last night to council, and no new cases have come in since. As of Monday the 7th, we've only had 4 cases. Through this week, we usually count our cases between Monday and Sunday. So we have 4 cases that have come in this week so far. Brings our total case count for the Pueblo to 198 cases since the beginning of the pandemic, with about 182 having recovered from the virus. Interesting good news that we always want to highlight is case counts across the country and the state are definitely trending downward. We were, for quite a few weeks there, we were above 800,000 cases a day in the United States. And now we're trending at around 600,000. Disregard the 4th zero in there. It makes it look like 6 million, but I had a typo, so my apologies. But it's 600,000 cases in the United States, which is the first time in quite a while. State of New Mexico was trending somewhere around 5,000 cases a day for a while there. And I think yesterday we had 1,800 cases, which is great, which is a significant drop in cases. So hopefully that trend continues, especially with the highly contagious Omicron variant that's been traveling around the country and the world. Still have a lot of hospitalizations. We had about 39 deaths in the state yesterday, so the death rate is still quite high. It's keeping up with the high numbers that have been showing up in the country and the state during the spike that we were having. So, as we've always been promoting, the best ways to minimize the spread and the risk of COVID is getting vaccinated. And currently, the only options are to go to one of the local pharmacies or to go to IHS by appointment. However, DOH has been gracious enough to work with us in the past, and they're talking about working with us again in the future, sometime in the next couple of weeks, to host a vaccine clinic here on site in the Pueblo. I'm waiting for a date to be established, and that will be communicated to the Pueblo and the community to make sure that people are aware that that's happening. Testing, there are still various options to get tested. The Pueblo here in our clinic here, we are still providing rapid test options. We also have PCR test options that we already have, but we're starting an expanded version of it here soon. The more information about that is to come. Home test kits are still being offered online. COVIDtestkits.org is a place to find to order your tests. However, the state is also providing us with another batch of home tests that we're going to be able to distribute to the community once we get them. And I think our distribution date, we're supposed to pick those up on the 14th of February. So our Valentine's Day gift for the community is test kits from the state of New Mexico. If you all are interested in contacting us to talk a little bit more about COVID, the executive order, what the restrictions are, what the requirements are if you test positive or exposed, you can contact us during normal business hours on the COVID hotline, 505-252-5986. We also use it for the on-call. There is a person that's always on call on the weekends for COVID-related issues. That number is how you reach that person. So if you need to talk to us, just about general COVID issues, to get masks, to schedule yourself for testing with the team, you can call us at that number. Also, if you come over to the building, because of the issues with COVID and exposure and the risks of contracting the virus if we're testing someone that's positive in the building, we don't want people just entering the building. So When you come to the building over here, there's a doorbell on the door. That's one way to get our attention and let us know you're here. The other way to get our attention is to call the COVID line. You can call the number, ask for someone to come and meet you at the front door, and we'll let you in. So just wanted to make sure everybody knew that. When you get here, don't just walk in. It may put yourself or other people at risk. So pay attention to the signs, use the doorbell, use the phone number. And let's see. So I don't know if everybody, some people might have seen it. I wanted to kind of get the answer about this out, about how the Pueblo is handling this in advance. The news was talking yesterday about the change. CDC is changing their asymptomatic isolation time period. They're putting it at 5 days. So what that means is you've tested positive, you have no symptoms. The CDC guidelines are saying that a person only needs to isolate for 5 days. Well, we don't necessarily follow the CDC guidelines. What we're following is what the executive order says. And what the executive order says is the isolation period is 10 days with an option to test out at 5. The reason why this is adopted, it was adopted by the Pueblo and instead of adopting fully the CDC guidelines, is that the studies have shown that up to 31% of people who tested positive for COVID, they're still contagious at day 5. So 31% may not seem like a lot when you're looking at statistics, but it's enough to be a risk to the community. So we've decided that we're going to follow what the executive order says. It is 10 days. You have an option to isolate or get out of isolation at day 5, but you have to take an antigen test. Don't go to the PTR and take a PCR test. Don't come to us and ask for a PCR test because, like we've said before, PCR tests can show you as positive for weeks, months after your symptoms have, you've gotten over your symptoms and you're no longer technically considered contagious. But the antigen test will kind of show your current your current status as whether you're infectious or if there's enough virus in your nose or throat that you can actually expose others and pass COVID along. So I just wanted to talk about that really quickly because I know there might be questions about that. But just remember, the Pueblo's executive order is the guideline that everybody has to follow if you live within the Pueblo. So wanted to make sure that was clear. So I'm going to open up for questions, comments, concerns, input from the rest of the team. If any. No comments. We have 6 viewers on. Any of the viewers out there? Are you have any questions or comments? Concerns? Okay. Well, without questions, we're going to go on to the second part of our COVID update. We're going to have Rebecca. She's going to provide some information about myocarditis, which is one of the things that a lot of people are concerned about, especially when it comes to vaccinations. The reports that there are cases of myocarditis with individuals, especially young people, the young portion of the population that are developing myocarditis post-vaccination. But that's well, we'll turn it over to Rebecca and let her talk about that. So,
thanks, Troy. So I'm going to go ahead and share my screen. Bear with me 1 minute. Don't go away. So, hold on 1 second.
Gonna mute it.
I don't know which one. Can you mute your mic? Because I get an echo. Thank you. I don't think that's anything at all. Is that me?
That shut off everything.
And I can't share. It's loaded, but it won't let me share it.
Okay. Well, just let me
There it
Go.
goes.
If you just did something that worked, you hit something and what was it? There we
it
go.
goes.
there.
All right. Now, I can't hear anything. People hear me? Okay, it must be the headphones. So today I want to talk about what COVID does to the heart. And these are just some of the conditions that are related. We have Takotsuba's cardiomyopathy, which is also known as broken heart syndrome. It's when the muscle of the left ventricle is weakened. We have arrhythmias, which are irregular electrical activity in the heart that cause irregular rhythms or abnormal heartbeat rates. There's cardiogenic shock, which is when the heart can't pump enough blood. Myocardial ischemia, which is lack or absence of blood flow to the heart. It's known to cause myocardial infarction, or what you know as a heart attack. There is what's known as acute cor pulmonale, and that's when the right atrium and right ventricle can no longer pump along with the left side of the heart, and that causes insufficient blood supply to the rest of the body and congestion of blood in the respiratory system. And lastly, what we're going to talk about today specifically is myocarditis. And myocarditis, you can easily break down the word into roots. And so you have the muscle component, which is myocard, means heart, and itis always means inflammation. So essentially the muscle cells in your heart get attacked and are inflamed, and it leads to multiple dysfunctions. So some of the causes of myocarditis are bacterial infection, fungus infection, radiation therapy for those that are going through radiation, pharmacologic and chemotherapeutic agents, autoimmune disorders, and viruses.
Explain this.
Explain the
Pharmacologic.
So pharmacologic means any pharmaceuticals that you take. There could be times when you're prescribed a medication that you've never taken before, and it might actually impact the muscle cells of your heart. It could also impact other muscle cells. So there's various pharmacologic agents such as muscle relaxants, anything that impacts the sodium or potassium levels in your system, because those are the chemicals or elements that control muscle contraction and relaxation. And that's what your heart is doing 24/7. It's contracting and then relaxing. And that's how it pumps the blood through your body. Chemotherapeutic agents are as related to treatment for different blood dyscrasias and cancers. Chemotherapeutic agents that you may know as chemo. Sometimes they can cause damage to muscle cells. And anytime you have damage, you will always initially have inflammation. And then what happens typically after damage and inflammation, you have results of muscle wasting, the cells die off, and sometimes there's necrosis. And I'm going to get into all of that and define that. But we would really want to focus on viruses with in relation to the heart and heart function. So let's see. So the infection of virus that leads to myocarditis process, it looks like this. The infective agent invades the muscle cells, which lead to the cell damage and possible necrosis. And what necrosis really is cell death. But because those cells are within our body, you have sort of the remnants of the cell. It's no longer active or functional. Then your immune response is activated. So some of the things that our body does when we're responding to an immune attack is we send different kinds of cells to the site of infection, and they have different roles. There are B lymphocytes, which is one of the white blood cell types. They go in and they have a partner called the memory B cells, and they remember parts of the virus they encounter. And this is actually partly how vaccines, the mRNA vaccines work, because those memory cells go in and they learn the spike protein and how to recognize it. So when we get another infection or exposure to those spike proteins, it can recognize it and attack to defend the body quicker and more efficiently. So oxygen-free radicals, you can kind of think of those as dead cells that your body needs to filter out. They're just, it sounds like a strange term to use when referring to the body, but they are degenerated cells and molecules that your body has no use for. So you need to get rid of those. Cytokines, and you may have heard of cytokine storm on the news or anywhere in relation to COVID. And what cytokines do is they initiate that inflammatory response. So anytime you get a cold or you have a cut and you see the redness and the swelling, those are cytokines. And what they're doing is they're attracting blood cells and white blood cells and red blood cells and clotting factors to come and repair that cut. So they're kind of like the little red flag to tell the rest of your body to do something. There are occasions when cytokines become overwhelming for the body, and that's how they are in relation to COVID. So as infection advances, the autoimmune response is activated. And what we mean when we talk about autoimmune, what happens is we start to generate cells that are known as autoimmune antibodies. And so your body, your system sends those antibodies to go and fight whatever is infecting your body. So those antibodies sometimes will attack good parts too, good cells, good tissues, and that can lead to the further destruction of the myocytes, which if we know myo is muscle, cyte means cell. So we're looking at muscle cells. Here is just a list of the symptoms that happen with myocarditis. They involve fatigue, an overall feeling of illness, achy muscles. Pharyngitis is a sore throat, nausea, vomiting, shortness of breath, swelling of the lymph nodes, especially in your neck or in your underarms. There's sudden intense stabbing or burning in the chest when inhaling or exhaling, which that is pleuritic chest pain. And what that name means is there is a lining in your lungs called the pleura. And what helps your lungs stay inflated when you're not exhaling, they return to that inflated state, is what's known as surfactant, which you might know comes in soaps and some other types of things we use every day. It helps the lung lining stay with the inner lining of your rib cage. So to sort of shorten that, what happens with pleuritic chest pain is the pleura become inflamed, and also they can get a little dry. And so you actually have this friction between your lungs, the actual lung itself, and the outer lining of the lung. And that's where that pain comes from. Lastly, you have a pericardial friction rub, which is similar. It's just with the heart. So you have the different layers outside of the heart that protect it, and they rub against each other and they cause pain. And in very rare cases, there are incidents of sudden cardiac death. It's not common, but it does happen. So what are the numbers? There are a lot of factors to deal with COVID. From the onset of the pandemic, myocardial injury was reported in 7 to 28% of hospitalized patients with COVID-19. A study performed by the Division of Cardiovascular Medicine and Department of Internal Medicine at Vanderbilt University Medical Center shows that of 330 patients, 40 had findings of myocarditis. 13 of those were children from 5 to 15 years old. 27 were adults 16 to 76 years old. And of all of those 40 patients, 37 were diagnosed with acute myocarditis. 3 of them had shown symptoms of having myocarditis, but had recovered or healed. So we want to encourage folks to keep in mind that we're still learning a lot about the pandemic. We're learning a lot about COVID specifically and how it works. And also along with that, how viruses work. We're learning more information about different viruses every day. But we want to keep things in perspective. Especially if you're in an immunocompromised state, or you have any chronic illnesses like diabetes, hypertension, if you already have a heart condition, even if you're healthy, you want to protect yourself. You want to wear an appropriate mask. And what I mean by that is keep in touch with what's going on in the world. Because this pandemic has been inconsistent with information, this virus changes frequently, and we want to be prepared for that. You know, it's nice to think when we're experiencing maybe a variant that isn't as strong, or we're having a lull in cases, that we can relax. But when we're going through surges and hospital admissions are up, we want to get back to protecting. So you have to sort of look at it as an ebb and flow of things. I can also say staying up to date with vaccines, boosters, and additional doses. Get vaccines when you're eligible. Get all of them that you can get. We all need the protection from some of these conditions. And like I said, there hasn't been a lot of super definitive information. So people are learning new things every day. And so we want to keep that in mind. Lastly, on how to protect yourself is don't accept inevitability as a current reality. Some people are talking about, well, should I just accept getting the virus? Everybody's going to get the virus. You still want to do healthy behaviors around protecting yourself. And don't just accept something when the news or media is pumping that up as the active role for immunity. And these are just the references that I used for the research that I did. Let's see.
So I see we have some questions.
I do have questions.
Yes, I do.
So I see Nina. So the myocarditis is a result of the illness, or were some having heart issues already? It's a mix. There have been healthy young people who have gotten sick with COVID and shown symptoms of myocarditis, and they have become chronic heart illness patients. So it's, like I said, the research out there is small in some of these instances. I think in the total study, they had like 330 people, and it narrowed down to 40. But that doesn't mean these numbers aren't significant. It just means we need to be cautious and keep watching and keep studying. And then you also asked, Mr. Water Vapor help in the house. What I can speak to this with is having a humidifier can definitely help with airway health, as far as keeping things moist in the air. I know in the winter it gets very dry. Our skin gets dry. Our nasal passages get dry. It's not going to necessarily help with any of the heart conditions, but it's definitely a comforting thing to have in the house. But you want to make sure that you're using purified water, or I think you can even use distilled water, and that you're cleaning the humidifier frequently, because sometimes things can build up in those machines and put bacteria or things in the air, which is counterproductive. But thank you for those questions. Those are very good. Yes, Denise, I was going to ask Claudia if she was going to play the piano there.
It looks like there are no more questions in the comments. Where'd you go, LaDawn? Oh, there you are. All right. So thank you, Rebecca, for that information on heart conditions related to COVID. That's actually something that a lot of individuals have asked questions about over the course of the pandemic, especially when it comes to the reports of myocarditis and vaccinated youth. And it actually has increased some vaccine hesitancy because, people think myocarditis and they think of death, or they think of, major physical injury or death or something like that. So understanding what it is and what the incidence of it is actually something that the community definitely can benefit from. Kind of help inform their decision around getting vaccinated, especially their young people between the ages of 15 and 34, because that's the age group that has experienced some incidents of myocarditis. But if we look at the nearly 6 billion doses of vaccines that have been distributed around the world, the incidence is extremely low compared to the number of vaccines that were given. So thank you for providing that, especially during Heart Health Month. That's absolutely important related topic to COVID. So appreciate that.
Yeah, and I can speak to myocarditis a little bit as it relates to vaccine. The numbers are typically around less than 10 for every 100,000 shows symptoms or signs of myocarditis. That less than 10 number is not definitively chronic or lifelong. You're welcome. So the data doesn't suggest that the vaccines largely cause myocarditis. It's a minor event. It's important, and myocarditis is serious, but it happens in so few folks that the vaccine is safe. So again, we're learning new things every day, but as far as it goes, myocarditis is not a prolific issue in relation to the vaccine.
Thank you. All right. Any more questions around COVID-19 or anything related to vaccines or testing or masks? Leanna, the question you asked, I don't know what. Explain more about the breathing that you're asking about. Oh, breathing exercises after COVID. Rebecca can answer that.
I can. Take these off for a second. So one of the things that we actually do in the hospitals when folks have respiratory illnesses, viruses, infections, things like that, we use something called an incentive spirometer, which you can purchase online and in some pharmacies. It's a device that is supposed to encourage inhalation of a specific volume. But you don't even need to purchase an incentive spirometer to do this. In fact, this is practiced in a lot of different modalities, one of them being like mindful meditation or just mindfulness. We often forget as human beings who are in a modern age, and we're always busy and we're always doing things or multitasking. Oftentimes we forget to take deep belly breaths. And that's essentially what an incentive spirometer forces you to do. So if you are, if you're having trouble breathing, if you have dyspnea, or say you have a chronic illness like emphysema, or even asthma, you can practice mindfulness breathing just by taking 10 big, slow belly breaths every hour. And what you're trying to do is breathe in through your nose, stick your belly out so that it takes in as much air as possible. And what you're doing is you're not only expanding your lungs, but you're getting oxygen to those very distal receptors in your lungs. Those distal air pockets, essentially, is what I'll call them. We breathe shallowly often, and so they don't see as much action, and that's how you lose lung volume when it comes to how much oxygen you're processing for your body. So that's a really great question. Anyone can do breathing exercises to help improve your lung capacity, to help improve your health. Shallow breathing isn't good for any of us, but I think in the day of modern technology and all of the tasks we do every day, we're always so busy working hard, we forget to take a moment to take some good quality breaths.
Thank you, Leanna, for the question. Thank you, Rebecca, for the answers. Anything else out there before we go into HHS updates and get prepared to log off? Okay. Before we go into activity updates, I wanted to add one more person to the live stream, who is our new Healthy Communities coordinator, Victoria Martinez. Wanted to give those of you who didn't know that she has started an opportunity to hear her introduce herself. Victoria, I see you're on. Can you hear us?
Everybody, I'm Victoria. I'm in the Healthy Kids, Healthy Community Coordinator position. My office is here at the Senior Center in the back, across from the ICWA office. What else? Yeah.
You want to give a little snapshot of some things you might have coming up, ideas that you might have coming up for the community? She's freezing over there. Can you hear us?
Let's see.
Oh.
Service is going in and out.
Yeah, I think that the connection there is kind of weak. Leanna asked a question. Are you asking if she's at the day school, Leanna, or are you asking? Oh, what is that fax number, Ray? I can't remember what it was. Oh, an update on the day school? Yeah, I think they restarted this week. I can't give you any specific details about what their services, how they're restricted, or what's going on there. But I don't have any. I don't have any update from. I haven't spoken to the principal yet, so we'll give an update on that when we get it.
The fax number at the
Oh, okay.
The fax number at the Senior Center building for ICWA and Healthy Kids is 505-455-2222.
And the reason why we're adding that number in is that the current phone number, the 505-455-2395, that's listed for the diabetes program and for the Healthy Kids program, it's not functioning right now. So what you see in the bulletin for how to contact them is not a way to contact them right now, because there's the line has to be dug up and relocated to the new building, so it's currently not active. So that temporary phone number for Healthy Kids, Healthy Communities, and even the office where LaDon and Rebecca are located is the 455-2222. Victoria can also be reached by email. Her email is vmartinez@sanipueblo.org. So that's how you can contact her if you need to. And to answer the question that Leanna was asking, so Victoria's only been here, a week and a half, Victoria? I think that's the time frame that she's been here. But we are working to increase and reestablish services at the day school and with the education department and Pawtucket Valley Schools and all the areas that the program has been working with and assisting with over the past years. It's just trying to get it all up and running and up to speed. So it is coming. Anything else? Next week, we're going to be having some presentations and some information that's going to be presented. LaDonna, you want to give an update on that since you're going to be doing that next week?
Yeah, I can do that.
I can't hear you. I can't hear any of you guys talking.
Hey.
I can hear you. I don't know.
Which microphone?
Here, you can use my mic.
Okay, I'll start that over again. So next week, on Tuesday, February 15th at 1 p.m., I'll be talking about the cardiovascular system, the function of the heart, and blood flow and cholesterol. So we'll go over a little bit of information regarding LDL cholesterol and then also HDL cholesterol. So it'll be a little bit detailed. It'll be a detailed conversation of heart health and things that we can do to improve our functioning heart system. And then also, this is the first part in a series in the heart health series. I'll have another discussion on Friday, February 18th at 11 a.m. And in this conversation, it's going to be a topic about building a healthy relationship with food. So there's there's quite a few studies, and it's kind of recent that doctors, there are studies about mindful eating and intuitive eating. And basically it's just that. And so we'll go in detail about being mindful about the approach or the moment that we start eating, or even before that, we're going to talk about preparation and just really being mindful about what we put in our bodies. So that's just a snapshot of what we'll be talking about next week. So join us or join me in the discussion next week.
And where can they find you?
What's that?
Where can they find it?
You'll find us here. We'll be here at the HHS, and we'll be live streamed here.
Okay. Thank you, LaDon. Any member of the team have any other updates about activities, things going on with HHS that you want to put out before we disconnect?
Oh, yeah. Yes. on Monday, February 14th at 1 p.m. We're going to have a live stream with Janelle Trujillo, registered dental hygienist for National Children's Healthy Dental Health Month. So that will be a little bit of fun and maybe learn something new.
Thank you.
As part of Love Your Heart Month or American Heart Month, we will be having our second health screening on February 25th at the Senior Center from 8:30 to 10 o'clock. So please come on by.
Thank you. Anyone else?
Yes, this is Dama Gonzalez. I was just wanting to announce that we will be starting our walk again in March. I believe our first walk will be on March 1st, and we'll start walking at 2 o'clock at the baseball field. So if you all come out and join us just for the walk is good.
Walk is good. No,
Also-
Jeannie, no dinner.
Also, I just received a information. It says that the Santa Clarion Casino Resort is hosting New Mexico Department of Health, who will be conducting a COVID vaccine clinic at the event center. It'll be February 15th from 10 a.m. to 3 p.m. and February 24th from 3 p.m. to 7 p.m. And it says to please sign up. And it has the place where you need to sign up. So maybe we can go ahead and post that on the Facebook page, Troy, so that people can sign up for that.
Yeah, if you can get me that information, I'll definitely post it so people can have access. All right. Looks like we're at 12:03 p.m. We've talked about a lot today. We talked about COVID, what it looks like in the community, kind of a snapshot of what it looks like in the state and in the country. With the good news of the numbers dropping, we want to make sure that we pay attention to the fact that the pandemic is not over. COVID is still contagious, still a risk to the community. So keep your masks on when you're in public places. Get your vaccinations and boosted shots if you're eligible, and practice COVID safe hygiene, washing your hands and sneezing into your elbows. You know, I think that's coming back into the conversation again, because it's not just COVID, it's flu season as well. So pay attention to those risk factors that we are all facing today. Thank you all for joining us and logging in. And from Health and Human Services and the COVID response team, I would like to thank you, and we will see you next week.